Welcome on behalf of the New Jersey Collaborating Center to the National Apprenticeship Week. As you know, we have been engaged with the New Jersey Department of Labor and the U.S. Department of Labor as an intermediary for this program. So again, welcome everyone to this session. The New Jersey Collaborating Center was established in 2002 through legislation and is housed at the Rutgers School of Nursing in Newark, New Jersey. And our purpose is to engage stakeholders and ensure that we have competent, future-oriented, diverse nursing providers available in sufficient numbers in preparation to meet the demand of the evolving healthcare system in New Jersey. The Institute of Medicine in 2010 identified that every nurse should have a transition into practice. And so today you're going to hear us talking about nurse residency programs, but the structure for this is truly through the apprenticeship model, which we'll explain as we go forward. So first I want to have you meet our team. I'm Dr. Edna Cadmus. I'm the Executive Director for the Center. And with me today is Dr. Daria Wazik, who is the Assistant Director for the Center, and Dr. Michelle Roberts, Clinical Educator at Rutgers School of Nursing. And before I even go further, I want to thank Michelle for all of her hard work because she will be leaving us to move to Florida. So we are going to miss you greatly. Behind the scenes, we have a lot of people that many of you know. Nicole Thomas, who is our department administrator, Betty Badrow, who often coordinates our clinical coordinator meetings, Teresa Pankowitz, who is responsible for ensuring that all of the closeouts get to the Department of Labor, Maria, who manages our finance, and Zyphon, who is our data analyst for the center. All important people to help us in moving forward. So in 2018, Governor Murphy actually established the Office of Apprenticeship at the Department of Labor. And in 2018, we did a survey and we also did some qualitative interviews with chief nursing officers, nurse educators, as well as nurse residents. And what we found was that there was a variety and mix of how the system was organized, and we felt that it was important to standardize it across the state. And so NJCCN is one of 5 state collaboratives in the nation. Our other partners include Pennsylvania, Maryland, New York, who am I missing? And now Tennessee. One of the grants that was released was Growing Apprentices in Non-Traditional Settings, and you'll often hear us talk about GAINS grants, and we're on right now GAINS 5, which we truly appreciate from the Department of Labor. And the goal was to really ensure that we addressed the growing market, and healthcare was one of the major targets for the grant. So we have many partners. We have partners from the U.S. Department of Labor who helped us in terms of initially creating these standards and continue to work with us as we enroll new nurse residents. The New Jersey Department of Labor Workforce Development Apprenticeship Office, who have been great colleagues with us, and the Rutgers School of Nursing. We have currently we have these hospitals enrolled in the program, which is 14. However, our collaborative actually consists of 22 hospitals across the state. These are our funded group right here. And our Vizient team. Our Vizient team really provides the content. Vizient is in over 700 hospitals nationally, providing nurse residency content and support. And I'd like to put a shout out to Evie, Dana, Kelly, and Meg, who have been really great partners in helping us initiate this whole program. So what does this program really offer? Well, it creates a pipeline of new nurses to support hospitals across the state. And when you think about when we actually kicked this off, we kicked it off in March of 2020. And we can all remember going back to March of 2020, COVID hit, and we had to pivot to make this program remote. And so, again, thanks to the coordinators of all of these sites, we were able to make that work along with Vizient to ensure that our new nurses had a very solid transition into practice. It improves retention of new nurses, and that's key because retention ultimately helps in terms of creating a return on investment for organizations. And this model provides a structure for learning. It also provides an increase in their wages from the beginning of the program to the end of the program, which is part of this model. So new graduates. Well, when we first started, we enrolled 610 new nurses. That was our first Gaines grant. And that was at the time, again, of COVID. So just think about that transition. As we look over the years, and we're now into Gaines 5, we have already enrolled, and this is still growing. This was the last count I did, but we're continuing to grow. 646 new nurses in the state of New Jersey. We anticipate that by the end of this grant, we will be over 700 nurses in this grant cycle. We promised the Department of Labor 600, so we have well met our expectations. But I really think that, we have all recognized that this has made a major difference in terms of nurse residents. I took from their comments in the data that we collect, some of the things that they said. And the nurse residents definitely felt that it was important to be able to be supported, that they had more time with their nurses and preceptors in the organization, that they wanted to feel like they had strong peer support. And that came out over and over and over again in terms of the importance of peer support during this process, which the preceptors and nurses in the organization certainly have provided. One of the key things that one of our nurses said in the comments was, at the beginning, it may seem hard and like it doesn't get any easier, but it does. As time goes on, things start to fall into place and make sense. Just give it time and do not give up on your goals. Ask everything. Never let anything be a question. Ask and learn, because it's better to ask and know than to wonder. And so I would just say that it was really something that we felt was really important over these last several years, and continues to be important for the nurse residents and the preceptors and the coordinators in the organization. So now I'm going to turn it over to Michelle, who's going to talk a little bit about what we saw in terms of the outcomes of this program. So Michelle, it's up to you.
Thank you, Edna. So for us at NJCCN, structuring the residency program using standards for registered apprenticeship allowed us to provide mentorship for new to practice nurses because of apprenticeship requirements for one-to-one preceptors. And that really helped ease the initial phase of transition. And that dedicated mentor allowed them to be continue being guided through their first year of practice. So for us, the scores of perceived support during transition really demonstrate that benefit of mentorship. And you can see over time with this bar graph that our residents definitely experienced feeling encouraged and having confidence. And all of this is our 12 months outcomes. Next slide, please. So next we have our outcomes of perceived competence over time. So this is based on a 0 to 10 scale, with the lowest point indicating feeling like the residents are novice at the novice level, and the highest scores reflecting them feeling fully confident. And for our group, you can see that over time, by the time we got to 12 months each year, that our residents in our program were scoring around 7, which is closer on a model that is used to demonstrate competence in nursing from novice to expert. So we wouldn't expect a nurse to feel like they were expert after 12 months on the job. That usually takes 3 to 4 years to get to that level. But ultimately, we're getting into that advanced beginner and competent stage and not yet expert. But that's great because they feel competent, and that's demonstrating again the benefits of our program. Next slide, please. The next outcome that I'd like to talk about is career progression, and this is reported in percentages. Organizational and career commitment is reflected in our program graduates who go on to advance their career and education after completing the residency program. So you could see over time, by 2023, we have 50% of our graduates have gone on to obtain a higher degree. We've shown that 40% in 2023 again have advanced along a clinical ladder, and many become certified in a specialty as well. And that's really attributable to the support that they get during the program, their immersion in the organization, and the support that the leaders provide to them. Next slide, please. And then increased retention. So we have really, this is one aspect of our residency program that I am very proud of, because when we compare ourselves to a national average, we can see here that based on a 4-point Likert scale, with 1 being a strong disagreement and 4 equaling strong agreement, that these residents intend to remain in their current position for the immediate future, our scores are pretty high. Each year, we've been not only consistent with the Vizient benchmark, but since 2021, when attrition was believed to be greatly impacted by the COVID-19 pandemic, our scores for our residents reflect a steady increase to remain at their place of employment. Next slide, please. And then last, return on investment. Again, this is another area where we have really excelled based upon our support from the Department of Labor, based upon our framework for residency. We have, compared to a national turnover rate of 28.7%, we in New Jersey are at 11%, which is really stellar. And given the average cost for each 1% of change in turnover, we have saved what would equate to over almost $7 million for our institutions here in New Jersey. So this is something that we will continue to work to support and sustain over time. And again, it's really because of the support that we've received from the Department of Labor, from the New Jersey Department of Labor and Workforce Development, and through our partnership with facilities throughout the state.
And part of our commitment to this program is to ensure that we continue to share this across the nation through our professional journals. And this is just a listing of some of the articles that we have had published. Okay, so now let me move on to the next part of our program, and that is our coordinator role, because they play a really key part in all of these organizations in keeping us in the know of what's happening in their organizations, but also in implementing this program. So let me turn it over to Renee. I'm going to stop sharing my slides. There we go. Okay, Renee.
Good morning.
So tell us a little bit about the program at Cooper and your role there at the organization and why it was important.
Sure. So good morning, everybody, and thank you so much for the opportunity to be with you all today. This is definitely my life. I live it morning to night, and it's fantastic. And I've seen such a transformation over the last couple of years. To a lot of that credit to the NJCCN in New Jersey and their initiatives behind this. So as Edna mentioned, I am one of the coordinators here at Cooper Hospital in Camden, New Jersey. And our program is actually a 2-year-long program, which is rather unique. Many programs are 1. So our program is 2 years long. That includes a 3-week generalized orientation when the nurses initially are onboarded. In that 3 weeks, we have a 1-week skills workshop where we focus on the fundamentals of nursing and ensure that this was really incorporated during the pandemic when a lot of the nurses were entering the workforce with no in-hospital clinical experience. But we've noticed even past that time that this is a really essential aspect of their transition into practice. So we've kept it and have had a lot of good feedback with this. During that 3 weeks, we also offer many courses for the nurses to take that help them care for our unique population here at Cooper. And the last piece of that is unit observation time, where they get acquainted with their new team members and really understand the logistics of their unit. So when they transition into unit-specific orientation, it's a little bit smoother. Following that 3-week orientation is their unit-specific orientation, which works concurrently with our classroom seminars. Those seminars include games, simulation, hands-on activities. We have presentations from our subject matter experts in the organization. We do case study review and many other things with them. That didactic portion of our program ends right around the 15 to 18 month mark of a nurse's practice, depending on when they're hired. And then we conclude the didactic portion with an evidence-based practice project presentation and graduation. So throughout that first year, they're working on these EVP projects. And we have a big celebration for them at the end where we print their posters for them, and we have a conference-style graduation where they get to present to the entire organization is invited to these, and we have really good turnout typically. And then we have a ceremony where they get their certificates. Their leaders are there with us. Their educators are there with us. Everybody's there to celebrate the end of their residency. And then following that, we wrap up their 2 years with the opportunity to shadow different areas of nursing, whether they're interested in a different unit in the hospital or if they've acquired a love for wound care, whatever the situation is or whatever their passion is that they're finding, we give them the opportunity to shadow that area of nursing for, they get 2 full shifts to be able to do that. Another unique part of our program is that we run 8-hour residency days, and those days actually count as one of their base shifts for that week. So if they're full-time employees, they work 2 shifts in the hospital with their patients, and then they come to us for their 3rd shift. And we have found that has really improved our attendance to seminars, and we virtually have no issues with attendance to the program now. So we at Cooper and my partner and I in our clinical roles have found that the impact and the importance of residency programs there's really no words to describe how essential these programs are to nursing. Specifically after everything that we've seen over the last couple of years, nursing has drastically changed, and it's very clear that the nurses need a lot of additional support in that transition out of the academic setting. I think we're also used to recognizing and addressing the needs of our patients, and we're finally getting to a time where we're recognizing and addressing the needs of our nurses as well. I would be remiss if I didn't give a shout out to New Jersey for really being in the forefront of supporting our nurses and showing their dedication to healthcare workers in general. They've really given us an incredible opportunity with the Gaines Grant and the collaboration with the NJCCN to really help us support and not only create, but really maintain a robust residency program. So as a clinical or as a nurse residency coordinator here at Cooper, we have a very exciting role. I've worked in a few various different leadership roles in the organization, and I have to say that this is not only unique, but definitely one of my favorite ones. We, as coordinators, we're advocates, we're mentors, we're teachers, we're oftentimes therapists for our nurses. And it really gives us a great opportunity to see our nurses outside of the really stressful clinical environment. They're very candid with us in conversations. They find that being in the classroom setting with them and seeing us in the hospitals rounding on them, they know that they have that advocate there for them. We've specifically here at Cooper, we've had a really good opportunity to advocate them with some of the changes that have come with their union contract recently. We've seen huge changes in our program that our CNA here has listened to every concern that we've presented, and it comes directly from the feedback we get from our surveys and just in the classroom. So like I said, this is by far my favorite hat that I've worn here since I've worked at Cooper. My favorite part of this role would have to be my time that I spend as a professional development mentor. I find a lot of satisfaction in my role being able to watch our nurses grow from very novice, timid nurses that lack confidence. And even in the short year and a half that we see them in the classroom, they really grow into strong and confident nurses that are really secure in their practice and their knowledge. And for even the ones that don't feel as though they've reached the competency level that they were hoping to reach by a year and a half in, their confidence has really grown and they know how to advocate for themselves. They know how to advocate for their patients. And a lot of the feedback that we see from our surveys that we give them, it's clear that the residency program has given them a lot of their tools that they now have in their toolbox to be able to provide that advocacy. As far as the Gaines Grant goes, the Gaines Grant and the NJCCN has really given us here at Cooper a lot more visibility and stature within our program. We've grown our relationships with the unit leadership tremendously over the last couple of years. I started in this role about 3 years ago, and right after we became a part of the collaborative. And even in this short period of time, there has been such a drastic change in what the evidence is showing that the nurses need as far as differentiating instruction and all of the components that go into the residency program. And I've found that we've not only have really improved our retention, but the satisfaction within nursing and within the organization has grown tremendously as well. I think we recently have just published some numbers about our retention. And as you saw, New Jersey is in the forefront of that nationally. But here at Cooper, we've seen a 32% reduction in turnover within this year specifically. And I account that to all of the efforts that's put into our monthly meetings that we have with the collaborative, the resources from Vizient. I think I bug our Vizient team frequently, and they're always very responsive to my questions. And they've worked with us specifically to gather a lot of the data for our academic partners in the area. And it's been really helpful for us to grow the relationship with our leaders in the building. And then we support our leaders in growing the relationships with our academic partners as a result of all of this work. So having this program has been absolutely monumental for us here at Cooper. When I started here as a nurse, we had our own homegrown residency program. And I will say that the difference in where we are now is just, there is no words to describe where we are now. So this has been truly impactful. I can see that the residency program is really paving the future for a strong nursing workforce. And I give a lot of gratitude to all of the ladies, Edna, Michelle, all of the ladies at the NJCCN and our collaborative. It's been very helpful for us.
Great. Thank you, Renee, for sharing your experience at Cooper. And I just want to identify that part of the program is there is a minimum of 144 hours of training. And that training is done in a way of applying as opposed to lecture. We're not trying to reteach everybody what they've learned in nursing school. What we're really trying to do is to help apply what they've learned so that they feel confident and competent. And they have 2,000 hours of precepted and or mentored time over that period of time. So there's always a resource for them to be able to reach out and to ask questions. So I think you guys have done a tremendous job at Cooper. You're continuing to work, and this is emblematic of what's happening across the state with all of our organizations. So again, thank you, Renee, for your hard work in the organization. I'd like to now switch to the preceptor, because the preceptor really is a key component of helping transition a new graduate into practice. And we're looking for innovative ways to do that. And so I'm going to go ahead and turn it over to Diane Esposito from Capital, because they've done some unique things with the preceptor model. So Diane, I'm going to turn it over to you.
Thank you. I appreciate that. I also appreciate being able to speak about this today. It's kind of a passion of mine. A little bit of backstory is when I was precepted years and years ago, I didn't have the best experience, which many of you may kind of relate to. I had a very militant preceptor who her goal, I think, was to make me cry, which she did not succeed until 7:05 when I was in my car. I did cry then, but she never knew about it. So this is something that I'm really glad that we got to do as a collaborative here at Capital, to kind of give our preceptors just a little bit more structure in their training in order to get those new grads transition into practice. I actually have a slideshow here that I wanted to share. I don't know if I'll be able to. All right, are you guys able to see that, I hope? Okay, so this is our CHAMPS program. We named it CHAMPS because our we said that it was Capital Health's acquiring model of pyramid of skills. So it's based off of a tiered model of precepting and learning. So you kind of build on each, and I'll go to just why we did it to start. So we just noticed there was a huge gap because we're finding our nurses here at Capital are becoming preceptors a little bit more quickly than we had in the past in their career path. So they're finding themselves as a preceptor a little bit earlier with a little bit less experience than what we're traditionally used to. So due to that increasing demand for preceptors as well from the residency program, we were finding that we needed to kind of do this in order to give them that good foundation to precept. So we redesigned our whole preceptor process and program with the preceptor and the preceptee in mind. So the new preceptor program here at Capital, we consisted of a committee of educators and staff nurses. We had a lot of staff nurses that were residents and then were preceptors as well, so they can give us a little bit more focal points on what was needed. We also had a bunch of educators and managers, any kind of leadership, anybody that wanted to come to the meetings was more than welcome to and have input into what we were doing. So the best practice model that we used was a tiered acquisition model, but we made it into a pyramid. So you kind of climb the pyramid is what we say to everybody. It's been taken off pretty well. People are pretty receptive of it. It begins with a very strong foundation that we added here at Capital. We have a foundation where the educator takes that foundational tier and goes in with the preceptee and gives them a good idea of just basic the environment of the unit and that kind of stuff, scavenger hunt, and then goes over the EMR and all of that. And it just focuses on working side by side with your preceptor, so it's almost a married state, preceptor and preceptee. And I always say when I teach and I round, I always tell them, you guys are together, except for the bathroom. You are allowed to separate to go to the bathroom. So they kind of find that funny, but that's really what we want. We want them to be side by side so they're not felt like they're being left alone. And it's just to build a stronger relationship for success. Our CHAMPS model, which is the Capital Health Acquisition Model Pyramid of Skills. It utilizes a model thoughtfully named CHAMPS. I came up with that, so I'm very proud of it. We also allow for newly hired nurses to progress at their own pace. So if you're coming into us with less than a year of experience, it's a very different progression of that model, of that pyramid and climbing of that pyramid than someone with 10 years experience. And they're able to get through those tiers very quickly if they've had that experience. And then if they don't, they can work at their own pace either way. And like I said, it's very side by side. We allow for progression of all the responsibilities to a full assignment. So they start out day one with a full assignment with their preceptor, but they're not doing all of the skills and all of the assessment and everything. So the preceptor's picking up where they're not. So you work side by side instead of having that you have 2 patients, I have 3 patients, a model that we're used to. This is my lovely artwork. This is our CHAMPS model. We have these, I think ad nauseum throughout the facility. There's one right here. I don't know if you can see it. You can't because of the screensaver, but it goes through our foundational tier all the way up to tier 5. And as you can see, they just gradually go up, and it builds on each tier. So the first tier, they'll do some assessments, and once they get that down for a full assignment, they move on to tier 2, where it's more of the medication administration, line maintenance, pumps, IVs, all that kind of stuff. And it just gradually goes up to the more high complex skill set. So our competency checklist also needed to be revitalized here because it needed to model our pyramid. So we ended up doing both one for RN and LPNs because we are having more LPNs at Capital. And it documents the competencies and skills as they are met on each level. It streamlines, standardizes, and maintains consistency throughout the orientation process. So we were finding not only are nurses finding themselves in the preceptor role more quickly, they're also finding that we are utilizing more. So we're kind of, we have preceptees that are having more than one preceptor at times just for scheduling or whatnot. So this way, when they come in, they can say, I'm on tier 2. It gives them a good understanding of where they're at in their orientation process. And it helps that preceptor just kind of jump off from there instead of starting from scratch. And this is what our check looks like. It does mirror, like I said, the pyramid model. So we have each tier is labeled on our checklist and our pathway here, and it goes through and whether or not it was met and all that. And again, this is something that the preceptee has with them, but it also gives that preceptor some responsibilities on the left-hand side, which we hadn't had on our previous one. So it gives them a good idea of what they're responsible for as well. And there's tier 2. So with that, we had a program that was online. It was about 8 hours of online. It went online during COVID, of course, because we weren't able to meet. So we went online. So we've actually moved that back into the classroom starting, I believe in January, we're starting that. So this is where they work through at their own pace, the orientation process, but we needed to redo the program so that we have the preceptor program for those preceptors in order for them to do this. They can move, like the experienced nurses move a little quicker. So that we're finding, we surveyed prior and then we rolled this out, and now we're starting to talk and survey. We'll survey again in another month or two. And we're finding from the preceptors, they feel like it's a little bit more streamlined for them and they're able to do it quicker. And they feel like they have a good handle on what they're supposed to be teaching. So this is our program. Our program now is very interactive. We've gone away from lecture. I know somebody had mentioned that earlier in the webinar here. We find that it's just more interactive seems to work better for them. We actually have a full day of interactive informative programming. And then at the end of the day, we're doing an escape the room scenario. And in order to get out of the room, if you will, you have to utilize the methods that were taught during the day. So we've been working really hard on that. We've got it down, and we've trialed it with some of the educators. We've had them go through the escape the room to see if they can get out, and they all have successfully gotten out so far. So we have another group going soon. So we'll see. We're hoping it'll work really well. It seems like it's really fun because they start to kind of discuss amongst themselves in the classroom as they're trying to get out of the room the methods that we were teaching. So it's really good for recall, and it's also good for retention of that knowledge. So any questions? Anybody have anything they want to ask me about our Lovely Champs program?
We may hold off on the questions.
Okay, sure.
Till the end so that we can make sure that we give everybody enough time. But I think the one thing that you identified, which is important, is having one preceptor or two is really the best practice. Because it's easier to hand off to one other person in terms of where that person is so that they don't go backwards, right? Everybody knows where they are because we all have gone through that process, right? Where you have one preceptor and then the next preceptor is having you do the same thing because they don't know what you've gone through the first time. So I love the progression that you've developed and how you have organized it at Capital. And I think it's a great model.
Thank you.
So thank you for sharing that with all of us today. I'm going to now turn it over to the resident panel because those are the people that we want to make sure has a great experience. Can you stop sharing your screen, Diana, please? Okay. So I'm going to go through and ask the preceptors to begin to introduce themselves and to tell us a little bit about their journey to nursing. Because we all have to get there somehow, right? And we need to hear a little bit about that. So let me start with, I see Nicole is on my screen. So let me start with Nicole, and maybe you, if you wouldn't mind sharing your pathway to nursing and, why was this really important to you to come to your organization? Tell us what organization you're from as well.
Hi, my name is Nicole Hope. I am currently working for Capital Health at their Hopewell location at their intermediate care unit. We call it IMU. So my path to nursing, I wasn't someone who knew I wanted to do nursing from the time I was 3 years old. I did know I wanted to do healthcare. So my path to nursing was a little bit odd, let's say. When nursing is actually my second degree, I did an accelerated BSN program. So during the time when I was getting my first bachelor's degree from Ursinus College in biology, I had gotten my EMT cert with the intention of trying to get some healthcare experience. And then I was at college during COVID. So that kind of waylaid my intentions to get ride time on the local ambulance squad, because I was worried about exposing myself and my roommate and missing classes and all of that anxiety during that time period. But it's presented with a really unique opportunity to be an on-campus contact tracer. So we were able to really relieve the burden from Montgomery County, Pennsylvania, by managing our own students. So that was really helpful. I gained great mentors from that and gained a much better understanding of kind of how the public health system would work in a time of crisis like that. So then after I graduated college, I was not quite sure what I was going to do next. My best laid plans for PA school at the time were waylaid because I didn't have the contact hour necessary. So I became a critical care tech at Capital Health, Deborah ED. So I had experience with Capital Health and I had a great team there. I learned so much about like basic hospital things I hadn't ever been exposed to before. So I decided to go back for my nursing degree through Gwynedd Mercy, did their 16-month BSN and went, why not go back to Capital Health? I had a great time there. So I decided to come back and I went through the nurse residency program and I had a great experience. I learned so much. And I'm so glad that I had come back to them to further my career.
Great. Okay, let me move it along to, let's see, we got Joanne. You want to tell us a little bit about your pathway to nursing?
Hi, yeah, sure. I was always involved in healthcare. I was a tech before I was a nurse, and I was lucky enough to be able to be a tech in like different situations, like nursing home, hospital. But I started to get really interested in wound care. So I just kind of always positioned myself when I was a tech to be with the wound care nurse. And I really was interested in it and loved it. And so I took that and I went to Rutgers BSN program, the accelerated program, went through that course. And then when I graduated, I wanted to have a year or so of kind of like generalized nursing experience. So I went to Inspira, which is where I work for now, on a med surg floor, which, for me was good because it gave me a variety of things that patients come in with. But the other reason that I picked it was because this particular Inspira that I work for has a wound care center that's attached to the main hospital. And the program really allowed me I picked the wound care nurse to kind of work with her, follow her around, and it really helped me decide that, yeah, wound care is really where my interest is. It was all good. I learned a lot of everything about many, many different things up on med surg. but really what I wanted was wound care. So the universe, all the stars aligned, and there was a position for me that opened up in wound care. I applied, I got accepted. So I been in the wound care department like 2 years now, I think. I'm the charge nurse now of the wound care department, and I'm actually going for a state certification in wound care. So that's kind of like my journey.
Thank you. Christina, let me ask you, and again, identify your organization as well, please.
So good morning. My name is Christina. I am a cardiac cath lab nurse at Holy Name Hospital in Teaneck. I've kind of always been interested in healthcare. I started at Holy Name actually when I was in high school. I volunteered there in pre-admission testing. And then I also did a healthcare discovery program, which I thought was really incredible that they offered Holy Name. It's kind of like an immersion program where like you kind of learn about like CPR, first aid, the basics. They even do like mock code, obstetrics, which really submerged me into healthcare. I then continued on to nursing school at Villanova in Pennsylvania. And then from there, I graduated during COVID. From there, I became a nurse resident at Holy Name. I worked in a med-surg unit for 2 years, and then I proceeded to move on to the cath lab. So for me, I've always kind of been interested in healthcare, and Holy Name has always been like a big part of my life, as it kind of really piqued my interest in healthcare there, and it's kind of helped me grow as an individual. So that's kind of been my journey.
Thank you, Christina. Let me ask Keegan to do a quick intro on him, because he's relatively new nurse resident. Oh,
Yes. Good morning, everyone. I'm Keegan Craig. I work at Capitol Health in the ICU. Just a little bit about my experience. When I was in high school, I graduated in 2020. I knew I wanted to go into something where I was going to be around people, work with other people, and I wasn't sure exactly what I wanted to do. I come from a long line of nurses. My mom is a nurse. Both my grandmas are nurses, and so they kind of put me in the right direction. And I went into nursing school at TCNJ. My first clinical during my sophomore spring was at Capitol Health. After that, I was offered a position as a UAP or a CCT. I worked that summer full time, and then I did PRN the following 2 years. This past May, I graduated from TCNJ with my BSN, and I stuck with Capitol Health. I've worked there. I love the people. It just felt like I was at home when I was going through the interview process, and I stuck with them, and I've been going through the residency program now since July. I'm still off orientation, but we're working to get me off. And yeah, it's been a really great experience, and I've met a lot of really great people along the way. And yeah, I'm really happy where I'm at right now.
thank you, Keegan. And Brittany. You're on mute. Okay. Brittany, can you hear us? I know you were having some technical difficulty. Brittany? Okay, we're gonna come back to Brittany once we can get her up and running. So for the group, for the nurse residents, why was a nurse residency program important to you? And any of you can jump in. I'm not gonna make each of you answer every question. Since it's 9:45, I want to keep us on time. So tell me, any of you, why was a nurse residency program something important to you?
So I know for me, yeah. That's okay. We'll both talk. So I know for me, when I was in nursing school, I was only just starting to hear about nurse residency programs. I hadn't really heard of them before because, like I had said earlier, I kind of fell headfirst into nursing. And I was kind of nervous about it. I'm like, what does this mean? So I knew that almost all hospitals in the region had them. And one thing that really drew me to Capitol Health specifically was that they had rotations, that you got to float through different units, see what it was, and kind of figure out what unit what units you would want to potentially pursue employment on. And that for me was really important, being able to gain experience in other areas and just pick up little tidbits, even if I didn't intend on pursuing employment on that particular unit. and also to have the support of other nurses that were going through the same situation that I was, just brand new. And it's really fun to be giving a report upstairs to someone and go, wait, I know you. You were in my cohort. So that really created that bond between nurses, even if they worked on different floors and would have never met otherwise.
Great. I think Joanne, you were going to say something as well.
Yeah. For me, we rotated through all the sections of the hospital, and that really helped me understand how the sections work together in the hospital. Because initially, as I said, I was hired on 3 North, which is the med surg unit, and all I knew was what 3 North, what their goals were for the patient. I didn't always understand why, when I was getting a report from the ED about an admission that I was going to get, why their information they didn't have the answers to my questions. And what I learned was that their goals for managing the patient in the ED are dramatically different than they are up on inpatient unit. And so, like, for me, it helped me understand why I was getting the information I was getting and why they couldn't answer some of my questions. And I think for me, it helped remove the negative feelings between the 2 units, because you don't know what somebody's, how do I say this? You have to walk a mile in somebody's shoes so you know what their situation is. And it really helped me learn what the other units were doing and why they were doing the way that they were doing it. So,
Christine, were you going to say something as well?
Yes, I was going to say for me personally, graduating in COVID, I felt I missed a few of my rotations at the end of my semester because we turned to virtual. So I felt like I had lacked that in-person skills. So it was important for me to enter into a nurse residency program, especially with the classes. That was like a really, really crucial part that I wanted to help grow as a nurse with. So I remember there was like different classes on like advocacy, nursing ethics, end of life care, which those are just like a few of them. Those are I remember were my favorite ones of them, but I felt like they really helped me grow as a nurse and my skill set, which I thought were really vital to being a nurse, especially during COVID, especially with end of life care, kind of being considerate of your patient, advocating because maybe their family members weren't there, which were most of the cases, obviously. And so it was a different time, but I felt like that was a really crucial part of a program that I wanted to join into to become a well-rounded nurse.
That's a great example of, the need for that training around end of life care, right? Because you came in at a time that it was really difficult. And having the support from the team at your organization to help you through that process. So that's a great example. What other skills and competencies did you guys gain? And could you give us like an example? That's a great example that Christina started off with. How about any of the other nurse residents? Can you think about some of the skills and competencies you've gained as a result of this program?
Looks like Brittany has her hand raised. I think she might be back in the system.
Oh, maybe we can get you now, Brittany. Go right ahead. Brittany? Can't hear Brittany, unfortunately. Okay, we'll get back to Brittany. We'll try anyway. Go ahead, Christina. I think you were going to say something. Was it your hand that was raised?
It wasn't, but I can speak if you'd like. It says to other things. I felt like during we had like an IV therapy session, which you don't really do IVs really in nursing school. So I felt like that was a really crucial like technique and skill that we had learned. Even like basic things like IV tubing, like priming fluids, going over order sets, matching everything up with your preceptor. I felt like those were really key like skills and important factors that like we went over and discussed together. And we also did a lot in our simulation lab. which we went over like mock codes because in a code situation you can learn about it so much on paper, but actually running through it in a simulation lab, I feel like is an important factor that helps prepare you for the actual event itself.
And it's really a safety factor, right? It gets you ready for when you have a code. It's a chaotic situation. Keegan, let me ask you.
Yeah, and just going off like what Christina said about practice with the IVs and all the practice that you can get just in like part of like the education sessions earlier on. We did a lot of stuff just like getting like hands-on experience, not necessarily in like those critical situations, but with like the code cart and just being able to like see like what's in the code cart, where this goes, you know? And I think just having that experience beforehand has like really helped me in terms of those when you get a really critical situation, you know? And so just having that experience beforehand, in like those first like couple weeks going through those classes, really getting those hands on when it's less of like a stressful time as it is sometimes on the floor, really helps just with like learning. And then when you do get up to the floor and you actually do get to do it, it just goes that much smoother. And so I think that the residency program has definitely added a lot to that as well, for me at least. And yeah.
Yeah, great. So we're getting close to the end of time, and I want to give people at least maybe get in one question. But I want to ask the nurse residents, what would you tell a new nurse exploring job opportunities about transition into practice programs like the ones that you've gone through?
Yeah, I actually was just recently talking to a couple people who are going to be new grads in May, and I just tell them look for a place that has a residency program. You get that much more support. I've had an unbelievable experience. I always talk about my experience, and I say definitely look at places that have a residency program because you will get that much more support in comparison to some of my other friends who I've heard who are just kind of like going through it at other hospitals. So yeah, I always recommend the residency program, and it's been an unbelievable experience for me, and I'm always going to pass that on to other nurses who are going to be in the field with me soon enough.
Great.
I think it it gives the new nurse exposure, and it's a safe place to ask questions. So my best advice would be, like, you come out of nursing school and there's this thought that you have to know everything, but you really don't know anything. But the nurse residency program gives you the opportunity to not just ask one question, but like to ask the same question 2 or 3 times, just in case you don't really understand it.
Great. And really, you do have the knowledge. The issue is, how do I apply what I learned? I've gotten a lot of information, but now how do I really take that and move it to the next step? And I think that's really the important part of this. And I hope that the clinical reflection times and those types of initiatives have helped you in terms of kind of sharing your thoughts and experiences with each other in a safe environment. And I think that that's really the key to what we're trying to ensure as we go forward. So how did your preceptors mentor you and help you along the way? I know you all had preceptors and mentors through your program. Some of you, like Keegan, I know is still in the residency program. Some of you have graduated. So how did your preceptor and or mentor help you along the way?
For me, I got very lucky to have basically one preceptor my entire orientation. I had a great experience with her. She was very supportive. Once she had confidence in my skills, she made me be very independent, which I think helped me a lot because as soon as I came off orientation, it felt very natural because I'd been doing that for a while anyway, but she was always there. If I had a question, I knew I could go right up to her. No problem. She's actually one of our assistant managers now. So I feel like because she was my preceptor and we built like a level of trust there, I trust her even more in the manager position because she's now in that new role, but she still feels like someone I can go to with questions or concerns. And I will definitely say that like having a great preceptor can change everything. It can make a huge difference in the success of that new nurse.
Great. Anyone
I
else
also
want to add?
I also really enjoyed my preceptor is still kind of I would say still like my mentor in nursing. She provided a lot of like support for me and guidance, especially in the beginning with applying that information that you learned in nursing school, and really like how to even just speak with doctors about different orders. What's your goal? What do you have all your information to go over with them? And then once like kind of we went through the stages of my first year of nursing. Afterwards, I then that's 2 years into it, I decided that I wanted to expand my knowledge. And then she helped me also as well with my career and how to advance it. And she was like, well, what are you interested in? Like, what area have you thought about? And then she kind of helped me guide myself. And then I found my love for cardiac cath lab was through her. So they also not only help and support you in the beginning with guiding you along the way, but they also help you with your career advancement as well. So I found it to be really crucial to being a new nurse and then developing as a nurse as well.
Michelle, did you want to add something?
And I just wanted to speak for Brittany because unfortunately she couldn't connect her video, her audio rather, and she did type it out. And she just wanted to share with you that nursing was never her passion either. She was a waitress, which is interesting. And then she had a seizure and ended up as a patient, and that kind of inspired her desire to become a nurse. And that honestly, that it was the compassion that she received from the nurses who treated her that drove her into the profession, and that she knew that she made the right choice once she became a nurse, and that she's enjoyed learning so much from having her mentor, and that she apologized for not being able to use Zoom effectively, but that the apprenticeship program has been meaningful for her as part of our collaborative in our residency.
Great. Thank you, Michelle, for sharing that. And thank you, Brittany. I know it's tough when you can't get onto the Zoom. Okay, so I want to first thank all of the nurse residents for participating with us and our coordinators. And I'd like to open it up if there's any questions. And I know, Daria, you were kind of monitoring to see if there were any questions for us.
Someone said amazing session. Thank you all.
Okay, thank you. Okay, well, I want to thank each of you for participating. We certainly have learned a lot from you, and we continue to work through this process. It has been a learning experience both for our team as well as I know your team, and we hope that we've been able to provide strong support and provide you with what you need to make this program so successful. So again, thank you, and thank you for being nurses.